Greetings and welcome to the Healthcare Administration Club. My name is Dr. Arubasa, and on this channel, I show current and aspiring healthcare management, administration, and public health students how to one, quickly and successfully earn their degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry. Now, if this is your first time tuning in, I am so happy to have you here. Just a little bit about myself. I am a professor of healthcare management, administration, and public health. I'm also an author, speaker, and global mentor. I have over 15 years of experience working in the healthcare management and leadership spaces. And lastly, I obtained all of my degrees. So my bachelor's, my master's, and my doctorate in healthcare administration. So it's safe to say that I am an expert in this field. Most importantly, I'm super excited to come on and serve as your trusted virtual mentor. Now, today's live stream is all about answering this question: how to choose the right career path within the healthcare industry, and specifically, how do you determine whether you should embark on a clinical or administrative career route? But before I jump into the conversation for today, there are two things that I want you to do for me. The first thing I want you to do is to subscribe to this channel. And the second thing I want you to do is to turn on your post notifications. So each week I'll be going live on Tuesdays between 12 p.m. and 1 p.m. Eastern Standard Time. And in my lives, I'm going to be sharing tips, tools, and resources that answers a lot of your questions that you may have about the business side of the healthcare industry, even questions that you probably can't find with a basic Google search. So definitely make sure you subscribe and definitely make sure you turn on your post notifications. So as I stated, today's live chat is all about answering the question of how to choose the right career path within the healthcare industry. And I think this conversation is really timely and relevant, especially if you are a student, undergraduate or graduate student, and you are in a space where you're wanting to go into the healthcare industry, or you're not even sure if the healthcare industry is right for you and you're looking for more information. Look no further. I have the answers for you. And so definitely make sure that once again you subscribe to the channel. So let me share a little fun fact about the healthcare industry. It is a $665.37 billion industry, and it's estimated to be growing. It represents roughly about 19.5% of the GDP, so the US GDP at that, the gross domestic product. And so if you are wondering if this is an industry that is financially viable and lucrative, it is. But particularly if you're wondering if there's a space for you as a healthcare worker in this industry, I would definitely tell you, yes, there is a space for you. So according to the Bureau of Labor Statistics, there are over 200 plus healthcare occupations. Yes, that's right. There's over 200 plus healthcare jobs. And with the Bureau of Labor Statistics, they have estimated that more employment is going to be available in the healthcare space. So they are projecting that roughly about 4 million jobs will be added to the healthcare industry by 2026. So imagine 4 years from now, there are going to be 4 million jobs available. So if you are working towards a degree, or if you're not sure if this is the industry for you, if it's an industry that has job opportunities, here is partly your answer. But even with you on the kind of the borderline, if you're not sure, if you're still trying to learn if this industry is right for you, you may be wondering, after that information that I just shared, why are there so many healthcare jobs? And I honestly believe there are two primary reasons why we see so many healthcare jobs coming up in the industry. And the first reason, we have a growing population. So just think about it. Your baby boomers, they're getting older. Your millennials, like myself, we are getting older. Your Gen Zers are getting older. And after the pandemic, we also seen a spike in the births of babies. And so as a result of people getting older, or people becoming born, their population has grown immensely. So, okay. And so as a result, that has also led to the second reason why I think there is so many healthcare jobs, is that it has led for an increase in healthcare demand. And so at every aspect of of one's life, whether you are being born to even when you're experiencing mortality, aka death, you will at some point of your lifespan need to patronize the healthcare system for either emergent or preventative care services. But for an individual who is just like, okay, this is all great. And yes, as a patient, I would need the healthcare system. But as a person who may be interested in working in the industry, knowing that there are 200 plus job roles that I can work in can be quite overwhelming. And I definitely understand that feeling when I think about my own journey in becoming a healthcare professional and really working in the healthcare management and administration spaces. This was not necessarily my top career choice or even first career choice. And so, and I graduated high school in 2005, and I went to a performing arts high school. I studied dance for 4 years, and prior to that, in middle school, I was also a performer. And so, in my mind, the natural route was after I completed high school that I was going to embark on potentially a professional career as a classically trained performer. I had even applied for a college in New York, and they gave me full scholarship to attend a full scholarship rather to join their university as a dance major. But unbeknownst to many of you, I have what is something that is called a Nigerian dad. And if you have an immigrant parent or know an immigrant parent, you know that there are only probably about 4 occupations that they approve as being suitable career choices. And so those 4 occupations include being a physician, aka a doctor, being a nurse, being an engineer, or becoming an accountant. And so nowhere on that list does it say becoming a classically trained performer. And so after sharing the news with my dad about my full scholarship that I won for the university in New York, he quickly was like, you need to find an alternative. And so I did find an alternative program, and I went to an HBCU that was located in Virginia. And my dad said the only way I can go to that HBCU if I study some type of medical degree, particularly in nursing. So to appease him and to really just be able to relocate out of the state, I told him, yes, I would do it. And I got into the nursing program, and I did 2 years. My first 2 years of undergraduate studies was in the nursing profession. And by the second year, I quickly realized, like, you know what, this is not for me. This is not an industry that I think I fancy, nor do I think I will be a great nurse. And so I quickly was sharing my thoughts with my roommate at the time. And she was just like, okay, well, try to come to my program, which was healthcare management services. And so my thing was, okay, if I do any other program, if I switch, I don't want to start all over again, because mind you, I have 2 years of undergraduate work under my belt. And so I went to the department, I spoke to the dean, I spoke to the director, and it was music to my ears to say, hey, yes, we would love to accept you. You don't have to start all over again. And from that day, I think that was one of the best decisions that I could ever made. I truly enjoyed and still enjoy working as a healthcare professional, more on the administration and leadership side. I've spent 15 years in the industry. My first job was being a practice manager for a private practice. And then I further expounded and found positions as a program manager. I became a trainer. I have worked in several healthcare settings, so both inpatient and outpatient. And what I tell you is that I truly love being a healthcare worker who understands the business side of healthcare and being able to support the healthcare industry with my business acumen and expertise. However, like myself, if you are wondering whether the healthcare industry is right for you and how to choose a right career path, it is very important for you to understand the differences between a clinical healthcare career and an administrative healthcare career. And when we think about clinical professionals, they provide or support the delivery of direct patient care services. And so when we think about your clinical workers, they include, of course, your physicians, your nurses, your pharmacists, even therapists, which are not often talked about, but therapists are a part of the clinical side of care, your patient care assistants, your medical assistants. They're really involved in making sure that patients get diagnosed, that they get treated, and that they are receiving care that puts them in a space where they can go back to live, hopefully, healthy and safe lives. And that's something I do want to mention. When we think about the healthcare industry, it is a business like any other business in different industries. But what makes us different is that we're in the business of serving patients at their greatest point of need. And your frontline staff and employees include these individuals who carry a clinical professional title. But on the opposite side of the business of healthcare, you have administrative professionals, and their role can consist of overseeing and supporting the day to day administrative operations of the healthcare organizations. So they're making sure that the budgets are in place, that we are generating revenue, that we are marketing to our targeted clientele, which are patients. And the different titles that you may find under the administrative professional in healthcare can include healthcare managers, financial representatives, coders, billers, and even health information technology specialists. So, a person like a clinical informatics individual to your IT personnel. So, with this industry, as you can see, with all of the many jobs that are made available, it is truly to speak to the need to treat every aspect of that patient or the patients that we see, and being able to support them and provide an environment in which patient care can be delivered to them. And so the healthcare industry cannot run without its clinical professionals, but it cannot also run without the individuals who are on the administrative side who understand the business of healthcare. And so if you are determining whether, once again, if this is the right career for you, or if you should even start a healthcare career, I want to give you 5 practical steps that you can implement today to make a decision on whether you should continue or even start a career in the healthcare industry. So, step number 1 is to ask the right questions. Like anything else that you may want to embark on, your passions, your hobbies, or even just making a decision about what you're going to eat today, you usually have to ask yourself a set of questions. Am I hungry? What do I feel like for today when it comes for food? Well, the same kind of approach should be applied when you are trying to determine whether the healthcare industry is right for you and how to select the right career under the healthcare umbrella that will allow you to serve effectively and to be able to feel fulfilled and rewarding in the work that you do. So, step 1 is to ask the right questions. And some of the questions that you can ask yourself include, what do you really want to do? Okay. I always tell my students, clients that I have worked with, as an employee who has worked on different type of care teams, I will tell professionals all the time, when you're entering this healthcare industry, you really have to take some time for self-reflection and determine whether this is the right place for you and if this is a job you really want to do. And then another question you can ask yourself is, where do you want to work, right? Do you want to work on the inpatient side of the healthcare system? Do you want to work on the outpatient side of the healthcare system? Do you even want to be in an area like insurance? Okay, because the healthcare system, it is multifaceted and it is highly complex, and it really requires individuals to continuously equip themselves with the right tools, competencies, and resources to be able to thrive in this industry, and furthermore to be able to push the industry forward. So you really want to ask yourself that question of, where do you want to work? What skills do you need to have, and what skills do you already possess that would be beneficial and serve as an asset to you as a healthcare worker? Okay. Remember, you play dual roles when you're entering the healthcare industry. You have a vast, or I would say better insight about the industry than probably if you were to work in any other profession, because at some point of your life, you have visited or even patronized a healthcare facility for care. So, you know, on at least the patient side, what it means to receive a level of care that will treat your illnesses, prevent illnesses from occurring within you, and saving many individuals' lives. But as a healthcare worker, you also need to know that there are certain skills that you must possess in order to navigate and efficiently support the industry and its aim to provide quality, safe, effective, patient centered, efficient, and timely patient care services. And next question that you should ask yourself when we talk about asking the right type of question is, uh, do you want to be hands on and directly dealing with patients, or do you prefer to be behind the scenes? Okay, for the most part, you don't really see the billers and coders of a healthcare organization. They work behind the scenes, but their role is very much effective. So you have to make that determination in when you are really in that place of determining what career is right for you under the healthcare umbrella. Another question, do you want to support staff like healthcare doctors or nurses, or do you want to support executives who run and are the decision makers, partly the decision makers, and making sure that the health facility is running efficiently? And then I think the last question is the most pertinent. How much money would you like to earn? That is key. Now, there are certain roles in the healthcare profession that are highly lucrative. And there are other roles that, especially when you're starting out in your career, where you're getting paid the minimum wage. And so for you, before embarking on this career path and really asking yourself, really determining rather, if you want to be in the healthcare industry, ask that question. Ask yourself that question. How much money or how much salary would you like to earn? I promise you, it makes a significant difference in what roles you go after, the kind of education you equip yourself with in order to be a sufficient healthcare worker. Then after you've asked yourself the right questions is step one. Step two is to conduct research. Right? So learn about the healthcare industry, especially if you have a very vague understanding of the industry, and you need to really, if you really are in a space that you want to go in this industry, but you just don't know where to start, research is always going to help you. If you're not enrolled in school, okay, then and you need to be enrolled in school, because for many healthcare jobs you're probably going to have to get some formalized education, then becoming a researcher is a great skill to have. Okay, you're going to always have to research, and if you learn how to research in the beginning, it will support you not only in your decision on whether this is the right industry and it's selecting the right career within this industry to do. But if you need to go and gather education, and I'm sorry, airplanes are passing by, but if you need to gather the right information, at least you know how to engage in effective research. And when you're conducting your research, there are some things that you need to do. So it's a very specific and strategy that you need to apply, and that includes writing down the pros and cons about the healthcare industry, especially if you have no experience working as a healthcare professional, but you've experienced it for the most part as a patient. You definitely want to ask yourself the right kind of questions and listing out the pros and the cons about the industry. As a healthcare major, you're going to conduct research anyway, so it's important for you to start now. Then after step number two, we move on to step number three, in which I would tell you to seek advice and connect with professionals who are in the industry. Okay, this is something that I wish I had the opportunity to do, especially when it came down to doing my doctorate degree. And that is a whole nother experience, and a experience to talk about in a whole nother conversation, right? But when I was deciding to do a doctorate degree, I wish I had took the opportunity to connect with professionals who were in the field, professionals who have already completed something like a terminal degree, and seeking their advice and learning from their lived experiences in the journey. And so if I can share it with you as a person who may be thinking about entering the healthcare industry, or if you're in the healthcare industry and you're determining which career path is right for you, is to connect with other professionals who are doing the things that you want to do or work the role that you want to work in the healthcare industry. Now, how do you find these individuals? You can look in your immediate network, or you can use platforms like social media. I highly advise you to connect on LinkedIn. LinkedIn is like business networking gold because you have everyone on there and they're on there for a specific reason, unlike other social media platforms where you can have a little bit of leisure, entertainment, and education. LinkedIn is really for career, business, and professional networking. And so it has everything like the titles, people's contact information. So in this day and age, it's really easy for you to find individuals who are willing, okay, that's the key word, willing to connect with you. So definitely reach out into your network. And then I would say in being reaching out or connecting, connect with people who are within the job roles that you enjoy or people who are outside of the role that you're not thinking of. And so most recently, I have been exploring the clinical research side of the healthcare industry and connecting with professionals to see what the clinical research process looks like. And I will tell you, there's some similarities in my experiences that I've had just being in the industry for 15 plus years, but also in my academic journey that now allowed me to be able to connect with the person and people in this particular specialty of clinical research and speak their language. Okay, so be open and be willing to move outside of your comfort zone to connect to get the answers that you need to help you make the right decision. Then, tip number four, or step number four, is to make a decision and create a game plan. Being decisive is a core competency or skill that you must have as a healthcare worker or healthcare professional. So it's best that you learn how to be decisive from now. Remember, unlike other industry, in the healthcare industry, people are depending on us to save their lives. And the amount of time that we have to make decisions sometimes is relatively short. It's in the moment. And so if you are a person who can be decisive, and you acquire, or if you're not decisive and you need help by determining whether the healthcare industry is right for you, develop that skill of learning how to make decisions that are effective, that are sustainant, that are goal driven, but also smart and can help you attain the goals and objectives that I have been outlined for you in the role, especially as a healthcare employee. Okay, so you make the decision and then you create the game plan. How are you going to obtain the necessary resources, skills, or competencies to be in this industry and to work in the role that of your choice under the healthcare umbrella? And so the creating that game plan is really about creating a roadmap for your next steps and for you to map out and to even write out your decision. Okay, there's something so powerful when you can decide what is best for you and what's next for you. And then the last step is for you to implement your plan, aka just do it, as Nike would say. Implement your plan. Okay. The only way you truly know if this is the industry for you, if it's right for you, is if you actually get into the industry. Okay. And so if you are a person who loves caring for people or you're invested in really helping the healthcare industry address some of its core gaps and things like policies and disparities that we see across the US and even internationally on a global landscape, then this industry is right for you. But you truly have to have compassion in your heart to see and to understand the things that people go through when they're sick and to understand how can we improve the system to be able to help it attain its core goal or its core aim, which is to provide quality, safe, effective, patient-centered, and timely patient care services. Particularly here in the US, our healthcare system is a pro-life system. And so it will do everything in its possible according to theory, let's just say it like that, in theory, to make sure that we are creating healthy communities, that we are treating people in their immediate point of need and allowing them to receive treatment that will allow them to go back rather into the living their day-to-day lives. Okay, so to recap my 5 tips, tip number 1 is to ask the right questions. Tip number 2, or step number 2, is to conduct research. Tip number 3 is to seek advice and connect with professionals. Okay, so this talking, having conversations are key. Step number 4 is to make a decision and create a care plan. And then step number 5 is just to do it. Implement your plan, do it diligently. Know that a plan always has room to be improved, knowing that because the healthcare industry is so massive, where you start doesn't necessarily mean that's where you have to end. I started on the direct patient care side as a practice manager and supporting direct clinical providers and their teams. And now I lecture as a professor. Okay. And in between that path, did program management. I did inpatient training everyone from physicians down to environmental service employees. Okay, so it is a industry where you have the opportunity to grow. It is an industry where you have an opportunity to pivot. It is an industry where you have the opportunity to make a nice living and generate income. It is even an industry where you can do the most important thing is to be able to save a person's life indirectly or directly. All right. So I want to once again thank you for joining in the Healthcare Administration Club. We're super excited for this inaugural live stream. Like I said, we're going to be live every Tuesday from 12 p.m. to 1 p.m. Eastern Standard Time for the most part. So definitely turn on your post notifications and subscribe. And until next week, bye.